Good morning, everybody. Thank you for that beautiful introduction. Nice to meet everybody. It's quite a diverse group we've got here. I would like to thank you guys for this opportunity to present some of the findings of my PhD. As Sesam alluded to, research on disability, even in practice, is something that I'm very passionate about. Some of the colleagues on this platform know me personally, some also within the professional capacity, and I hope to meet everyone soon enough. One of the things I wanted to say is today we have quite a variety of professionals on this platform. I think many discussions have been held where people have indicated interest, even from the IT architectural sphere, where they would want to know more about disability and see how they can bring their expertise to assist within the social work space and within the care living. So quite excited that we have had some of those introductions here. So I am a clinical social worker by profession. I'm working as a social worker at St. Joseph's Home for Chronically Ill Children in Western Cape. And I'm currently registered as a PhD student at the University of Johannesburg. Prof. Adrian van Breda, who is the co-host of this platform, is my supervisor. And I've got another co-supervisor, Prof. Curley, Benny Curley, who is from Queen Belfast University. She guides me through the disability aspect because that is a lot of her knowledge and expertise. So I would like to thank Girls and Boys Town for arranging this platform. Thank you, Lee. Thank you, Sesam, for ensuring that we have a platform where we can start these sort of discussions. So if I can go just right into my PowerPoint, but I would like to ask if Sesam, you can just screen share. Can I ask if there are questions? I don't know, Prof, how do you want us to do it? If they can be put in the chat, and maybe a few we could take and some maybe for further discussion.
Yes, I think, Wendy, I think that's a good idea. So people could write comments or questions in the chat, and then we could pick them up afterwards. And there'd also be time for sort of verbal interaction with you for questions.
Okay, that's perfect. Thank you so much. So Sesam, I would just like to start sharing the PowerPoint presentation and then start the presentation, if that's okay.
So Wendy, I see that Sasam's got kicked out again. So I'm wondering do I have the most recent version of your presentation?
Yeah, you can use that one. I have made highlights, but just to back myself up for load shedding, I have a hard copy just in case we experience some power cuts. So you can use the latest one I sent through.
The latest one. Okay, just if everyone could just give me just a sec, just go and find that latest one. So that's the one you sent on Tuesday.
Yes.
Tuesday evening.
Yes.
All right, just give me one moment and then I'll be ready. I see, sorry, Sasam is having some challenges with connectivity, so.
Okay.
All right, give me a second. I'm almost there.
That's okay.
Nope, that one. Nope. That one, there we go. All right. Good. Can we just get a confirmation from anybody in the group? Can you see, is it showing up Gauteng Child and Youth Care Centre Practice Forum?
Yes. Yes.
Fantastic. Thank you so much. So when you just give me a cue on moving through the slides.
Okay. All right. So if you can move to the next one, that's perfect. I've just done the introduction, but I'd like to speak to the title. So the title for this, I am writing an article on the findings of this research, and I've got multiple articles. So particularly for this forum, I thought it would be interesting to speak on the preparation of young people with intellectual disabilities and autism spectrum disorder for living care in South Africa. If you can just go to the next slide. So the outline of the presentation, I'm going to just quickly fly through the introduction and the background of the study, why the study is of particular interest to me, and then I'm going to explain the methods of the overall project of the study, as well as the methods I've used specifically to this article. And then I'm going to touch a little bit on the South African legislation, as well as the model of disability that we're using for disability in South Africa. Then I'll define key terms to the study. Sesam, I just get there's something popping up on my screen. I'm not really sure what to do with it. It says entering a waiting room.
Just ignore it. I'll handle it. Thanks, Wendy.
Oh, thank you. So I'm going to define autism and then also intellectual disability so that we can follow the discussion quite easily. And then the next point of discussion would be preparation for leaving care. And then I'm going to speak a lot. I'm going to spend a little bit of more time of the time to present on the findings and the discussions. And then the recommendations that I am bringing forward. And then the conclusion and some questions and answers. I do, however, put a disclaimer. Some of the questions I might not be able to answer, but please do feel free to bring them forward. We can take it up and then always email some of that feedback. Thank you, Prof. Next slide. Okay, so this study really focused on young people with intellectual disabilities and or autism spectrum disorder who grew up in the South African Child and Youth Care Center. So I say and or autism because some of them might have a diagnosis of autism, and then they might experience some intellectual or cognitive difficulties, or some of them have both intellectual disability and autism. Some have got a separate. I just thought it might be useful to clarify that. Next slide, Prof. Okay, so if I look at the background, what really made me quite curious, as Sesam indicated earlier on, is my interest in disability. My career in social work is really just, the foundation is being disability. I started at the University of Johannesburg within disability. So a lot of skills fall off my eyes in terms of understanding human development and understanding diversity and the uniqueness of each individual and the variety of support that is required that we need to put in place to ensure that we are actually honoring our South African Constitution. So the transition of young people from alternative care into successful young adults is the subject of much research globally, as well as now it's picking up also in South Africa, practitioners and policymakers. And as people on this platform, you're working with children in residential care facilities that have to transition to adulthood on a daily basis, if I can put it that way. So we want to see how does it look, the transition. We want to know a little bit more when it comes to children with intellectual disabilities and or autism. What does transition look like, and what do we need to put in place for them to transition out of the residential care into adulthood or into other adult facilities? So although there's been a lot of research when it comes to caregivers without disabilities, there's been very little research of caregivers with intellectual disabilities, very limited at this current point in time. There are several international studies, but what I find is that there is no research in South Africa, and at this point I haven't found any research within the whole African context of how young people with intellectual disabilities and autism transition from care into adulthood. So it really made my eyes pop and got me very excited. So this presentation, we want to stimulate and start discussions, questions, thoughts, comments are all welcome, so that we can think, how can we look at the care leaving preparation process for people with intellectual disabilities and autism? What do we need to put in place? What do we know? What don't we know? And I think it's of important. It's quite good that we've got people in practice on this platform that you're able to give us your insights into what you experience from one child and youth care center to another in terms of the transition. If you've come across cases where children have got disabilities, what was the transition like for you? So as I alluded to earlier on, my study is it's actually, I used the overall PhD project. I'm doing it by publication, thesis by publication. So I have to write up some articles. I'm busy with that. But my research method for the overall project is mixed methods. What I mean is that I'm using qualitative and quantitative elements for the research. So particularly for this subject of topic we're talking about, preparation, I only use the qualitative element because I interviewed the young people whilst they were still in care. They were about to leave, about to turn 18, but I only use the qualitative element. And then the follow-ups of the other ones, I use the quantitative. So I utilized a longitudinal research design, which follows the same sample over a long period of time. And in my case, I followed them over 18 months. So COVID happened. I was supposed to have conducted this research within a 12-month period from 2019 October into 2020 October, but as all of us are all aware with the global pandemic, we've had to shift and adjust and pause and pick up again. So it infiltrated my PhD. So I was able to finish the last round of interviews in March 2021. So I'm presenting on the findings of this particular study. And then I also use semi-structured interviews to conduct the interviews with 8 young people that were in the different child and youth care centers in the Western Cape, as well as their caregivers, professionals that were working with them. I also interviewed them before they disengaged from care. So I analyze my data using thematic analysis manually. Next slide, Prof. So if I'm looking at the South African legislation, the South African Constitution and disability legislation adopts what we call a social model of disability. So I'm just quickly going to explain that. This implies that the government will provide policies and guiding frameworks in practice that aim to remove all aspects of discrimination for people with disabilities. So the social model aims to remove disabling constraints in the society. So these are things that prevent people from reaching their full potential or from equal participation like the other person without a disability. Next slide, Prof. So what is social model of disability? Like I've alluded to, it aims to remove disabling constraints in the society. So the social model of disability, it really separates the impairment and the disability, and it really locates it within the society. So what does society have to offer to another person who might have requirements, special needs that need to be considered in order for them to participate to the best of their ability? So the focus on social model is not the individual. So it's not the impairment per se, but an oppressive society that is disabling people with impairments. So I'll give an example that maybe a lot of people may be able to relate to. So if a student is trying to come into a lecture, but they are on the stairs and there isn't a ramp, would we say then it is the person's fault not to be able to access, or it is actually a disabling society because they've passed, they're at the university, but they cannot access the venue? So the society needs to have enabling structures that allow for full participation of people with disabilities. So with this approach, it really emphasizes that the responsibility is on the state to ensure that the policies and legislations are inclusive of people with disabilities, and not just inclusive as on paper. We need to really put the supportive systems in place in order to meet their needs. And as I'm going to go into the definition, we'll slightly touch on the uniqueness of the individual, even though they have the same maybe diagnosis or disability. So that would really speak to the supportive system that are going to meet the person's need. Thank you so much, Prof. So defining intellectual disability and autism. So I just want to highlight to the forum that defining disability has been and continues to be a contentious topic. What I find with my overall studies that across the nation, across the globe, there are quite different definitions of what disability entails. This affects how the people have access and how disability is actually captured. So the prevalence, we are struggling to get the accurate statistics because of how disability is captured, especially when people have got ranges from mild to severe. And sometimes when you are mildly affected, then you might not necessarily qualify for disability support, especially in the form of social security. So coming to the definition, the Diagnostic Statistical Manual DSM-5 defines intellectual disability as a neurodevelopmental disorder that begins in childhood, and it is characterized by difficulties in conceptual, social and practical areas of living. So if we're looking at conceptual, we're looking at things that like counting money, the social aspects, the social interactions that we have, the practical areas of actually doing your self-care living, your self-care skills, and all of those things. And then autism spectrum disorder is defined again by the DSM-5 as a neurodevelopmental disorder, which is characterized by persistent deficits in social communication or interaction across multiple contexts and unusual repetitive behavior. So some people might be familiar with people with autism. It's quite on a big spectrum. So you've got people who have mild on the spectrum, mild to moderate, and then severe to profound. And this speaks to their different requirements in terms of needs. Some people are verbal, some people are non-verbal. So it is quite unique, and that's why it's important to put in place the supportive systems that meet the needs of that person in terms of achieving adulthood or in terms of the transitional process. Thank you, Prof. So coming to the reason why we're all here, the preparation of young people with intellectual disabilities. So the South African Children's Act of 2005 has got a baseline guideline on the preparation process for caregivers for non-disabled youth, but then it really give a clear blueprint in terms of what needs to take place when it comes to caregivers with disabilities, more especially autism or intellectual disabilities. So it leaves the responsibility on the child and youth care centers to really conduct multidisciplinary team meetings where professionals come across the table to discuss what their responsibilities are and what needs to be put in place for the child. And then to conduct review panels where exit plans are also discussed, and also case discussions in terms of what resources are available, what difficulties, challenges are being encountered in that specific case. And then also family group conferences are conducted where professionals also identify the intervention that the family perhaps might require, and then sort of share amongst the professionals whose responsibility it is to capacitate the family, address certain aspects, if it was behavioral, if it was child care issues that were challenging due to lack of understanding of the young person's needs. So, and then the other aspect is the inter-agency collaboration, which also helps to clarify the roles and responsibilities during the transition period. So in some cases, children transition from pediatric disability services to adult disability services. And it's not just a matter of opening the gate and then they move from one residential facility to the other. The agencies need to have collaborated and met and perhaps share care plans and all of the other information that needs to be handed over that affects the well-being of the young person. So all of that responsibility is on the child and youth care centers. And at this current point in time, what I find with my research is that it's quite diverse. And as I begin to engage with the findings, I think you'll be able to highlight the discrepancies in what one child and youth care center does and what the other one does. And I'll also put forward some of the quotations of the young people and how they've experienced the transitional process. Thank you, Prof. Can I just ask, Prof, that you keep me in check when it comes to time?
Yes, Wendy, you're on 15 minutes, so you're doing good. Very good. Excellent.
Okay, thank you so much. So I have written up 4 findings from this particular study so far, and I am going to be speaking to those findings, and then I'm going to be giving some quotations from the caregivers, which is the young people with intellectual disability or the young person with autism, as well as their caregivers, because I interviewed them also at baseline, trying to get a picture of how they were involved in the care living. And in that initial one, I also interviewed some professionals that are working with the young people, some occupational therapists, some directors, some social workers were also interviewed in that. Next slide. Okay, so one of the first findings I got now is I found that there is a lack of attention to the specialized needs of young people with intellectual disabilities and autism. And there's a wide range of variation in terms of their functional independent living skills within this population group. So what I also found is that each child and youth care center has different care living preparation plan. So the timelines are not quite clear in terms of when you get a young person at the age of 10, at the age of 15, when do you start the transitional process? When do you start putting certain things in place? So mostly it was, mostly also I found that the information, it was generically applied to all young people with care living, and there was no adaptation and consideration in some cases for people with intellectual disabilities or autism. So the youth care centers have got a standard maybe way of doing individual developmental plans, care plans, review plans, but none of it was sort of adapted to fit the needs of the young person with a neurodevelopmental disability. And then also the process broadly involved actually letting the young person know and when they're supposed to be leaving, and not so much from what I could hear, the participation of the young person in the process. And some of the quotations may be able to highlight that. So it was almost like a reminder, we have this date coming in and you're going to be leaving to this place, sort of a reminder for them, and not necessarily what your feelings are when it comes to this and what are you hoping to achieve. I think I found that a little bit lacking. So one of the occupational therapists at one of the CYCCs said, we do not specialize in disabilities, and we had to learn firstly how to provide care to Lee. Honestly, I'm worried about his departure from us. I think that the process is not clear on who has what responsibilities regarding preparing him to leave care. His exit plan is constantly changing, almost with every review panel. People around here do not understand intellectual disabilities and actually think that he's just behaving badly when things do not go his way. Applications to several adult facilities were made by the external social worker, but he was not accepted in any. He has multiple conditions and no single agency wants to admit him. They all give feedback on how they'll not be able to handle either his intellectual disability or epilepsy and poor self-care skill. This system is not adequately equipped to deal with children like Lee. He would live here, but he might become homeless because the same house he was unable to stay in previously, he must now go, and not much has changed. So looking at this statement, it's quite heartbreaking to see that there's a lot of confusion in terms of understanding the young person and what needs to happen. And with every review panel, the plan was changing for this young person. And just to also indicate, I've used pseudonyms, so the names in the quotations are not of the actual names of the participants. So this really shows a lack of specialized planning. Who does what and what's the plan? And adult facilities are also full. So where do the young people requiring additional support as adults go? I'm going to continue with Sihle. Next slide, Prof. So Sihle's caregiver also alluded to the same difficulties. So she said, I'm not sure what will happen to him. The social worker has not said anything to me. I think he will come back to me. He doesn't have anyone else. He does not speak properly. He can speak, but not able to tell you. I'm not sure if I'll have to take him to the hospital checkups if he comes to me. He is diabetic also. So he will need someone to always watch what he eats because he doesn't understand why he cannot eat everything. With his Down syndrome, a lot of things do not make sense to him. He will never be able to live alone. Someone has to help him. The CYCC can only take them up to a certain age. Thereafter, no one really knows what's next. It feels like it becomes someone else's problem. So just hearing some of these things, it really speaks to the discrepancies, like I'm saying. Now it's already two, the one of the professionals and one is the caregiver, where the young person was supposed to be going to. And she also sounds like she's also unsure. And then one of the caregivers said, she indicated that her transition was basic, and she feels that some of the needs for person with autism were not really catered for. She indicates, she says, I know when I'm leaving, I've learned some skills to help me, but there are a lot of things that I'm still not sure of. I don't know who will provide counseling when I need it. I also don't know how to apply for a disability grant. Perhaps my mother will help me with that. I'm still not sure how to use public transport or get medical help. These things make me feel anxious, and sometimes people really do not understand me. And then in contrast, we also have one of the child and youth care centers, which the director of one of the child and youth care centers, who with 3 of the participants that were in that facility that were also at the verge of leaving care, indicated, in my experience of running this home, I've come across many professionals who do not understand these invisible disabilities. Some are uninterested in educating themselves in order to provide better care. I must say, I'm lucky because I employ my own social workers. So I'm able to screen their knowledge of intellectual disability. Our preparation starts when the child is admitted, when we are drafting their care plans. There isn't a specific manual that we refer to. Fortunately, they are passionate about fetal alcohol syndrome. So we are passionate about fetal alcohol syndrome. So we read and also learn best practice from other international organizations. Then we adapt our services to fit the South African context. So when we admit children, we teach them various skills. We put them in special schools where necessary, so that we can develop skills to help them after they leave. There aren't a lot of options of where they can go, especially when they are severe or profound on the spectrum. So we have developed our own adult facility where those that are likely to be faced with homelessness when they leave, in their case, their transition starts months before they finally have to leave. We conduct review panels. We have urgency meetings to get some stakeholders on board and gather resources to assist with the exit, but it is very difficult. The support on adult services in South Africa is extremely limited. So with this last bit, you can see that there is something to learn there. I quite appreciated the extra mile that this particular professional went. There were limitations identified and still try to ensure that within reason, they have stretched their support to ensure that this young person that they've worked so tirelessly all these years does not end up on the streets. So there is something to learn and something to consider. Thank you, Prof. Then the second finding of my study is that there is a need to provide tailored and there is need to provide tailored support that is tailored to the unique needs and capabilities of each individual. The significant impact of care living on the sense of belonging and the sense of security of young people with disabilities is quite profound. So we need to really consider a person as a whole and not just look at you're turning 18 and then off you go. And yeah, we need to really consider the relationships a young person would have established whilst they're in care with various professionals, as well as with the other children, and how we can assist them with that transitioning. So we've got one of the young people quotation here was aiming to live independently. So Clive said, I'm going to stay on the farm for a little bit. Then I'm going to move out once I have saved enough money. I want to live by myself, but I'm not sure about cooking though. I do not really know how to make real food. I can make a sandwich and I can fry meat, but that's about it. I still have to learn, otherwise I will starve. So looking at this quotation, you can hear that this young person with an intellectual disability is on the mild of the spectrum. So he's able to...
Stop it.
He's able to... I think that's Joyce's Baba. He's able to function independently within reason. However, he still has got some functional aspects that he requires help with. It's actually part of the basic human needs. He needs food to survive, and he's not really sure of his cooking skills. And surely we can't expect him to survive on sandwich and braai only. He needs a variety of skills. So, and then we look on the other end of the spectrum. This is now a young person with autism. So Gary is severely, sorry, next slide, thank you. Severely autistic. and he has limited verbal communication and independent living skills, and also he experiences extreme auditory sensory difficulties. And in some cases, this can escalate in public, and sometimes it leads to self-injurious behavior where sometimes he bangs his head. And when interviewed, the only goal he had for his future was from time to time to be able to leave the house. So not to be housebound, but to be able to do something, to leave the house and go and do some form of an activity. But owing to some of the things that have been mentioned there, one can begin to see that a lot needs to be put in place, because just going to a mall can become quite a difficult task, because there is auditory sensory difficulties that he may experience, and he may struggle to regulate his emotions, and he may have meltdown owing to that. And how does that look like for the caregiver? How does that look like for the young person in a public space? So what do we need to put in place for that transition if we want him to experience the fullness of life? Thank you, Prof. Next one. So I've got quotation here from Gary's caregiver. The caregiver says, "It must be noted that he'll never be able to live by himself. His brain works like that of a 5-year-old." And this young man is 19, if I'm not mistaken. I interviewed 18, 19. I interviewed him when he was 17 years old. So coming back to the quotation, his brain works like that of a 5-year-old, yet he's already a young adult. He will always need help. He will always need an external brain to enhance his quality of life. If left alone, he will be vulnerable to all forms of abuse. He might even hurt himself unintentionally. His sense of danger does not exist at all. What has always been difficult for us was being in public with him. He can get overly stimulated by certain sounds, and he experiences meltdowns in public. Sometimes the meltdowns are really bad. He bangs his head, and sometimes people stare at you. Coupled with his size, if you don't know what to do and how to handle him, he can hurt you. You have seen how big he is. So just to give you a picture, this is a young person who, at the time I was interviewing him, he was 17 years old, and he was weighing about 150 kgs, and he's quite tall, I think maybe 1.7 meters or something to that effect. So he could tackle the caregiver or the person who would be with him in a public place. So one thing I want to just note is that the low expectations and paternalistic view of the carers in these codes are based on genuine care and concern for the young person's future. Although they may be potentially negative and have a negative effect on the young person's self-determination and strength-based person-centered planning, we need to look at person-centered planning to reassure the support, the carers of the support that and move and avoid reinforcing dependency. So even though we may feel that the views of the mother may be paternalistic, this is a reality, this is a truth, and there are genuine fears and concerns about the well-being of the young person after leaving care. So if I look again at another caregiver, the mother of one of the young person who also has got an intellectual disability but has got limited functional skills and difficulties again in emotional regulation. The mother said she indicated fears of having the child return to the local community and the safety within that. She says, "Lee will always need lifelong care. He can never live alone. He doesn't understand everyday life, and at times he experiences seizure, and they happen a lot. Although he's on medication, it has not stopped. His self-care is poor. Sometimes he does not go to the toilet alone. He is still bedwetting at night. If he should come home, I don't know what I'll do with him. My house is small, and I know he will struggle to cope like he has over the years, which is why he ended up in a CYCC. I love my son, but I'm not able to take care of him full time. I do not have the means to provide support he needs. I'm also sometimes scared of him. When he does not understand, then he is teased and gets angry. He becomes aggressive, and I cannot hold him down. He's grown now. He breaks windows, and he breaks windows, and I stay in a violent and gangster gangster infested area. And if he comes home and walks on the streets and he has a misunderstanding with someone, I'm worried he may be shot. So from this, we can really hear genuine fears, genuine concerns. What is in the context of South Africa? In the Western Cape, we're struggling with gangsterism. We are struggling with violence. And in a case of a young person of his age, who was also at the time of the interview about over 160 kgs, quite physically big in stature, the mother could not tackle him or assist him when he's experiencing a meltdown or struggling to understand. So one can only imagine if he's walking on the streets in his local community and there's a misunderstanding with one of his peers, how that would look like. Will they always understand? Because his disability is not always visible to the naked eye. So how do we assist with the transition back into a community, back into a family with grave concerns like this? So the next slide, Prof. So what I'm really saying here is that we need the needs of young people aging out of care are quite diverse. With some of the quotations we have seen, we can really see it's quite a variety. Some have got comorbid conditions, some have got only one diagnosis, but the severity and the functional skills are quite different. So having said that, it is very important to start the planning process for their transitioning out of care quite early. This gives us ample time to look at resources, to put things in place. If we need to put visual schedules, whatever we need to, and network with the communities, then there is ample time. But if we leave it to the last minute, a lot of things are rushed, and the only person who actually suffers is the young person. The family may also experience suffering, but the one who becomes discriminated against is actually the young person. The next slide, Prof.
About 12 minutes left, Wendy.
Okay, I'm almost finished. Thank you. So the third finding I got was there is a need for increased participation and transparency in the planning, in the transitional planning. So young people with disabilities, some of them are not always included in the planning process, and they're not always sure what's going on. So some of the quotes here will also highlight some of that. Lee was worried about leaving care and who would take care of him. He even presented with some behavioral challenges related to anxiety that was brought on by uncertainty about his future. He said, I don't know where I'm going to go and I'm worried. I don't know who will take me to the clinic and give me my tablets when I have a seizure. Mr. M always checks on me, and sometimes he brings me extra socks and extra clothes. So there's genuine worry about where he's going to go. And then next slide, Prof. So the uncertainty about the future sometimes really bring a lot of anxiety to the young people, and some of them really experience a lot of difficulties with retaining information. So they have memory difficulties and they may forget if things were explained to them. So what can we do to ensure that they're able to understand certain things? So Peter, in one of the young people, said, I'm not really sure how everything will work out, but here at the center, I knew where I was supposed to be. And if I got confused, I could always ask Beth, the social worker. People are friends here. They know us and what we struggle with. When I leave, I have to make new friends, and I'm worried about that. And then I'm just going to quickly go. And also says, when things happen so quickly, I get confused and upset, and I have meltdowns. I kick for them, I swear, biting people and kicking the wall. This is a young person with an intellectual disabilities due to fetal alcohol syndrome. So the change is also, she struggles to comprehend that. So Lee also indicated the same thing. He said, they lie for me. Sometimes they tell me I'm going to a place for people like me. Then they tell me they did not get a place and I'm going to my mother's house. It is not safe there. They are shooting. I tear my clothes and I hit my head against the wall when I'm upset. Why they lie for me? So there is genuine anxiety, fear from the caregivers and from the young people themselves. So there's a lot of value in the participation and making sure whatever we do in the planning meetings and the transitional meetings, the review panels, that the information is pitched to an accessible level for the young people with an intellectual disability and autism. there's value in participation in the young people because it enhances their transitional process. One of the young people, Clive, from one of the CYCC, was informed quite earlier on. And then he said that I have been enrolled in a mentoring program since I was 14 years old, and I know where I'm going to live after leaving the children's home. I know the people and I can ask for help. I'm not too worried. My fear is that people might see that I'm not like them because I forget stuff a lot. I'm going to stay at a farm in a rural community. So this young person was engaged in a mentoring program for, I think, plus or minus 4 years before the actual transition happened. So this is a clear, good example of interagency collaboration and how it enhances the young person's quality of life and even extends more resources. If you compare maybe some of the quotes, you can hear the levels of uncertainty and anxiety differing depending on how much they're involved and how much they know. And the last one of my findings is the social isolation and being exposed to discriminatory public attitudes and behavior. So a lot of young people expressed concerns about fear of discrimination and public attitudes towards them. So some people may not believe that they've got a disability because they look at them, they're walking, they're talking, and it may not seem as if they've got a disability. So Clive was one of the young people who said, people out there are not always understanding of my needs. When they look at me, I look normal, but I struggle to remember information. I think that it will be difficult to make new friends like I have here. People can be mean also. So I'm scared that sometimes I have to speak up for myself and I might not be taken seriously. So some of the skills, even teaching them to advocate for themselves. What are we putting in place to capacitate the young people for the transition to adulthood? If we think of ourselves as adults, we are able to sometimes stand up and say, I do not like this, and we're able to have choices. Are we doing the same when we get the children at a young age in a child and youth care center until they transition? Are we taking that job as corporate parents quite seriously? So there's a lot of anxiety about leaving care that I also noticed, and they also wondered if they would be understood or accepted, and they also were weary of the relationships that were going to be terminated owing to their disengagement and the disruptions it brought to their sense of belonging. And in some cases, some of them had been in care for quite a long time. Some had been over 10 years in the same residential facility that the outside community would be a little bit strange to them, and they wondered if they'll be able to cope. So my findings are similar to the next slide, Prof. The international findings that I have also identified. They also highlight the complexity of the transitioning of young people with intellectual disabilities and of autism into adulthood in comparison to their non-disabled counterparts, and that there is a big gap in the transitional planning process. So I think today I am very excited that I was able to share some of those findings with everybody here so that we can begin to think of what can we do differently and what can we put forward to ensure that maybe we design some blueprints. So I'm going to quickly rush through to the next slide, Prof. I think you can skip it because it speaks to the same thing also. That the findings also speak to the lack of support systems for young people in the society. So the question I want to almost leave the platform with is, why do we have to prepare in advance? We have to prepare in advance because people with intellectual disabilities and autism have difficulties in understanding others and sometimes in being understood themselves. They also struggle with abstract concepts, money, in understanding emotions. Their social and relational, emotional, and functional difficulties also need to be considered. And then we need to put enough time to plan, because this will help to enhance their outcomes. We are aiming for positive outcomes when they transition to adulthood. So we need to surely put certain things in place before they finally leave. So we need to prioritize care leave in transition for young people with disabilities in order to enhance that process. So the recommendations I leave with you today is number one, for young people with intellectual disabilities, the transition needs to be a gradual process. It can't be an abrupt, they cannot be overnight become adults. That doesn't work. Even for your children, for your relatives, nobody becomes an adult at 18. So surely we shouldn't expect them to be turning to becoming adults overnight. So we need to gradually start the transitional process. It needs to be well planned, and we need to start early in order to harness support from a range of interdisciplinary services, because we know how busy we all are in interagencies. So if we start early, it gives us ample time to network and to have roundtable meetings on the best practice that we can put for the transitional process. Interagency collaboration also needs to be considered for the development of individualized care plans, and young people need to participate in the planning meetings. We need to pitch the information to an accessible level for them, visual pictures, tracking, having calendars for them in their rooms, wherever they are, so that they're able to follow the discussion. And then perhaps a standard procedure on the transition of young people with neurodevelopmental disorders needs to be considered, and perhaps training for professionals across CYCCs, especially to share knowledge and information that we all have, so that we can begin to move towards a non-discriminatory and an inclusive society. In closing, I say that care living preparation is important for young people with intellectual disabilities, and it helps to develop on the skills for life. And it also is important to mobilize support systems and to plan their exit and phase it, just what I was alluding to earlier on. And then we also need to have the meetings and to seek access of specialists, especially for aftercare services, and really make that transition from child disability services to adult. So in conclusion, looking through the lenses of social model of disability that we utilize in South Africa in our policies and in the Constitution, we can clearly see that there is a big gap in the care living transitional process, more especially for young people with disabilities. And we are failing to adequately plan for children in transition. And in a way, we are disabling the young person. And there may be various reasons as to why we are not getting around to the planning for people with disabilities, but we need to have clear pathways in terms of care, so that we all can have sort of consistency in the way that we render services for the young people. And we all need a collaborative effort in addressing the gap in the policies and practice, and having platforms like this certainly is a step in the right direction in terms of ensuring that we've got an inclusive approach when it comes to childcare and their transition. Thank you very much.
Thank you very much, Wendy. That was really very, very enlightening. I'm sure for most of us, when you were going through your presentation, Lee's story speaks to most of us that have, worked, and we've all had children or youth in care, that, we identify with Lee very, very well.